Welcome to a comprehensive overview of pericarditis, an inflammatory condition affecting the sac surrounding your heart. In this video, we'll delve into the causes, mechanisms, symptoms, diagnosis, treatment, and more, providing you with a thorough understanding of this cardiac ailment. Pericarditis arises from various factors. Infections, particularly viral, are a common culprit. However, bacterial, fungal, and parasitic infections can also trigger the condition. Autoimmune disorders like lupus and rheumatoid arthritis, as well as kidney failure, cancer, and certain medications can contribute to its development. Chest trauma, prior heart surgery, and even radiation therapy can also be potential causes. In some instances, the exact cause remains undetermined, referred to as idiopathic pericarditis. The pathophysiology of pericarditis centers on inflammation of the pericardium, the double-layered sac enclosing the heart. This inflammation leads to fluid accumulation within the pericardial space, known as pericardial effusion. The inflammatory process can also cause the pericardium to thicken and become scarred, a condition called constrictive pericarditis. Both effusion and constriction can impede the heart's ability to pump blood effectively, leading to a range of cardiovascular complications. Pericarditis affects individuals across all age groups with a slightly higher prevalence in men than women. It is estimated to affect approximately 0% of the population annually. It is an important cause of chest pain, accounting for around 5% of emergency room visits for chest pain that isn't caused by a heart attack. The incidence may be higher in specific populations, such as those with autoimmune diseases or chronic kidney disease. The signs and symptoms of pericarditis can vary in severity and presentation. Chest pain is the hallmark symptom, typically sharp and stabbing, often worsened by breathing or lying down. The pain may radiate to the shoulder, neck, or back. Other symptoms may include shortness of breath, fatigue, palpitations, a low-grade fever, and a dry cough. In some cases, pericarditis can be asymptomatic, discovered incidentally during a routine medical examination. Diagnosing pericarditis involves a comprehensive evaluation, starting with a thorough medical history and physical examination. A key diagnostic tool is the electrocardiogram (ECG), which may reveal characteristic changes indicative of pericardial inflammation. An echocardiogram. An ultrasound analyzes the pericardium and detect any effusion or thickening. Blood tests may be performed to identify inflammatory markers, such as C-reactive protein, a CRP, and erythrocyte sedimentation rate (ESR). In some cases, imaging studies like chest X-rays, CT scans, or MRI may be necessary to rule out other conditions and assess the extent of pericardial involvement. Pericarditis can be categorized into different types based on its duration and presentation. Acute pericarditis is characterized by a sudden onset of symptoms and typically lasts less than 6 weeks. Recurrent pericarditis involves repeated episodes of inflammation after an initial episode has resolved. Chronic pericarditis persists for more than 3 months. Constrictive pericarditis, a more serious form, involves thickening and scarring of the pericardium, restricting the heart's ability to expand and contract. The treatment of pericarditis aims to reduce inflammation and alleviate symptoms. Nonsteroidal anti-inflammatory drugs and NSAIDs like ibuprofen are often the first-line treatment. Colchicine, an anti-inflammatory medication, is frequently added to NSAIDs to further reduce inflammation and prevent recurrence. Corticosteroids such as prednisone may be used in patients who do not respond to NSAIDs or colchicine, or in those with autoimmune-related pericarditis. In cases of bacterial pericarditis, antibiotics are administered. Pericardiocentesis, a procedure to drain fluid from the pericardial space, may be necessary in cases of large effusions causing cardiac tamponade. In rare instances of constrictive pericarditis, a pericardiectomy, surgical removal of the pericardium, may be required. While not always preventable, certain measures can reduce the risk of developing pericarditis. Prompt treatment of underlying infections and autoimmune disorders can help prevent secondary pericardial inflammation. Avoiding activities that increase the risk of chest trauma can also be beneficial. Adhering to prescribed medication regimens and following up with healthcare providers for regular checkups are crucial for managing underlying conditions that may predispose individuals to pericarditis. The prognosis for pericarditis is generally good, especially with prompt diagnosis and treatment. Most patients recover fully without long-term complications. However, recurrent pericarditis can occur in some individuals, requiring ongoing management. Constrictive pericarditis, if left untreated, can lead to significant heart failure and may require surgical intervention. Recent research is focused on identifying novel therapeutic targets to reduce inflammation and prevent recurrence. Studies are also exploring the role of genetic factors in susceptibility to pericarditis.